Thank you everyone for joining me again today. We welcome back Dr. Ghazala Aziz-Scott. Ghazala, I can't wait to explore today's topic with you, which is all about fertility, something I've journeyed through myself, as I'm sure have many, many other women out there. And for those new and unfamiliar with who Dr. Ghazala Aziz-Scott is, I just want to remind you that she's women's health expert, practicing NHS GP and currently working privately using her functional medicine hat at the Marion Gluck clinic, where there's a firm focus there on bioidentical hormone balancing. And an area I know that you're increasingly specializing in, Ghazala, is this whole field of integrative fertility. I mean, let me kick off with that. What does integrative fertility mean?
Integrative fertility means that our fertility is very often a function of our general body health. So when people are presenting with fertility issues, we need to look at what are the underlying health issues that are driving the infertility. It doesn't always mean that, it's an irreversible diagnosis. There may be very definite health factors that are causing people to have issues with fertility, and those factors, if they're reversed, can actually restore fertility without people having to resort to IVF treatments.
I think that's fascinating because my own journey through fertility, I mean, I conceived naturally first time, but then things didn't work out, and it was a 7-year fertility journey. And actually, it was a combination of like mental, physical, and emotional. So the sort of triangle of the three, and having to kind of bring all three together. I want to just ask you, before we go into the sort of nitty gritties and get really dirty in this, about childbearing years. I mean, I had my children, the first in my 20s, and then subsequently, after going through this fertility journey, the two arrived into my mid 30s. But it's changed so much just in one generation. So tell us a bit more, and if you have some statistics to offer, that would be incredibly helpful.
Yeah, so no, there's been a massive change in fertility in terms of the age that women are childbearing over the last 10 to 15 years. Now, some of these delays are because we are wanting to become more educated. People are getting married a lot later in life. They don't find their life partner till they're in their mid-30s. People focus on their careers. Even the structure of the way careers are structured these days, you have to put in a pretty much, full-on effort in a professional career for the whole of your 20s and part of your 30s to feel that you've got somewhere. People want financial security, and our own expectations of life before we want to become mothers have changed. We want to have an established career, we want to travel, we want to do things, we want to spend time with our spouses. So I think these factors have obviously had a big impact. And the other major thing is effective contraception. So when we're looking at the Office of National Statistics data, we know that women born in 1989, so that's the first cohort to reach 30, almost 50% of women are childless by the time they get to their 30th birthday. Now, that was 38% in our mother's generation and 20% of our grandmother's generation. So you can see in just a few generations what difference it's made.
Say that again, because that's literally doubling in 2 generations.
Absolutely, absolutely. So 20% of our grandmother's generations remained childless at 30. But now it's 50% of us remain childless until we're 30.
I mean, that's just incredible.
Huge.
At that rate, our daughters and then their daughters, I mean, potentially their daughters, if it doubles at that rate again, I mean,
it can't double at that rate again, because it's really not going to be biologically possible. But humans do tend to push the boundaries, with scientific progress. We call it scientific progress. So, I was just researching that, what are the oldest women who have had ART to get pregnant? And there are 2 women of age 72 and 74 in India who've had egg donation IVF, and it's resulted in a successful pregnancy.
ART, for those unfamiliar with the language, is artificial reproductive treatment.
Artificial reproductive technology. Yeah. So, I mean, the two-child family remains the commonest family size. And it's not that women are remaining childless, it's just we're shifting when we have our families, you know, to beyond our mid-30s. You know, I'm thinking myself, I had my first child when I was 35, and both my grandmothers, my paternal and my maternal grandmother, got married when they were 14. So they had teenage pregnancies, you know, and that's just in 2 generations. So, you know, when we look at data from the States between 1991 and 2001, the number of women who had their first birth between the ages of 35 to 39 increased by 36%. But what is even more staggering is that the number between 40 to 44, aged 40 to 44, leapt by 70%. So we're seeing many, many more mothers who are, you know, in their 40s now. And so that's big change.
Yeah, and I can understand that based on what you were saying before, because actually for a lot of women who are choosing to work, I mean, remember, women coming into the workforce really started to push through in our generation. Like, I would say our generation was the first one where we were taking the jobs that men could do, and that's just continued. And it's kind of what you said before. We're not, you know, it takes at least a decade or two to build up the seniority and experience in any profession. So there's that trade-off, isn't there? Like, just as and I've many friends who were in this position, just as they were being given partnerships in a law firm or reaching the sort of seniority in their profession, they're suddenly having to consider child bearing if they are choosing that particular route.
Yeah.
So in your clinic, this rise of sort of infertility and this change in choices, where's that kind of leaving women with respect to the age and where we are at mentally, emotionally, and physically?
I mean, it's a great biological unfairness, really, isn't it? But I think, you know, more and more women are delaying childbirth to beyond the age of 35. And actually, there's a very, very stark drop-off in fertility after the age of 35. So it's not that you can't get pregnant, but it just is harder. And age is the major factor. It's the major factor in our fertility. And actually...
What's harder? So tell me biologically.
But biologically, it literally is what happens to our eggs. So with increasing egg age, there are more chromosomal abnormalities, there's more DNA abnormalities within the egg, and there are more mutations. And so increasing egg age means that it's much, much harder for that to be a viable pregnancy. The other thing is, as we get beyond the age of 35, the second half of our cycle, where we produce progesterone in what we call the luteal phase after ovulation, that luteal phase becomes less strong. And so therefore the miscarriage rate goes up. So miscarriages go up, number one, because we have more chromosomal abnormalities in our eggs. In fact, I think I was reading some statistics that a 45-year-old egg will actually have 75% of genetic chromosomal abnormality. So it's really quite high. So therefore, it's nature's way of saying, well, this is not a viable pregnancy. It very often ends in miscarriage. And then progesterone is very important to keep the lining of the womb healthy enough to take implantation. So if the progesterone levels aren't good, they're not adequate, then that's where, you know, the miscarriage rate goes up. So, you know, in IVF clinics, for instance, once people have had a successful implantation, they will be given extra progesterone to make sure that the lining of the womb is adequately progesteronized so that, you know, that it can be a successful pregnancy. I mean, I think there are also changes in the lining of the womb. The endometrial lining becomes less sensitive to progesterone as you get older. So there's so many different factors that hit us as we get older.
It's funny because last time we spoke, we were talking about the menopause and the perimenopause, and 35 seemed to be the age where that's all starting to kick in. So you've kind of got this battle, if you like.
No, totally.
You know, embrace this later fertility at a time when it's quite naturally thinking about shutting that cycle down or start to wind it down anyway.
And this is if the average age of menopause in the UK is 51. So, you know, fertility actually ends about 5 to 10 years before the menopause. So you can see that if the average age is 51, some women go through it earlier. So you can see, like, from your mid-30s, changes are beginning to happen. Now, it happens sooner than we expect sometimes, because 1 in 100 women have premature ovarian insufficiency. So they have a menopause below the age of 40. And then 5 in 100 women have premature menopause, where they have menopause below the age of 45. So, you know, that's quite a high percentage, you know, and so we're not factoring those things in. You know, we're not thinking, oh, that might happen to me. We don't often know. The other thing is, because people are on the pill for so long, and very often people go on the pill in their teenage years or in their student days, and then they'll remain on it for a decade or two. You know, I see women who've been on it for 15 years, 20 years, and then when they come off the pill, they have no idea whether they were menstruating, they're not menstruating, what their natural hormonal patterns are. So actually, you know, they remain quite ignorant of what their body is doing, because they are inducing artificial periods and they're taking synthetic hormones through being on the combined pill.
Ghazala, fertility, I want to, an IVF, okay? You said something and it sort of really triggered for me. So I had IVF. I had 2 rounds. I share it today, but it's something that it took me a long time to share, because of this shame, in a way, that I remember feeling at that time, of needing or having to have IVF in the first instance. And I couldn't help but feel that a lot of the inflammation and issues that my body had subsequently, linking into, I was one of the premature menopause people group, may be connected to the after effects of having IVF. So, you know, what are the impacts of IVF that your clients might be discussing with you?
Yeah, well, I think the whole IVF journey, I think women are missold quite a lot of information. And I think people think that, well, if I can't conceive, I can have IVF. And they're not really aware of what IVF entails, and also the fact that it doesn't have a massively high success rate, and age is also a factor there. So essentially, you know, what if you have IVF when you're 35 and IVF when you're 42, there'll be a big difference in your success rate. So I think, you know, people are missold information. We're not really aware of actually what it entails. Each 1 in 4 implanted embryos results in a live birth on average. So people have to have about 3 cycles on average to get 1 live birth. And people don't realize the massive impact of the very, very strong fertility drugs that you're given. Now, IVF has become a lot more successful. So we're seeing more and more women post age of 35, women in their 40s, having successful IVF. But why has it become so successful? One of the reasons is because we are using stronger and stronger fertility drugs. We're also using other drugs. So a lot of women will go on prednisolone, which is a steroid, which, you know, we use prednisolone to deal with autoimmune conditions, inflammatory conditions, because prednisolone as a steroid decreases inflammation. So that's why we take, you know, prednisolone is given in IVF to help, you know, the embryo implant and help it progress. The other thing that we use a lot in IVF is a drug called tacrolimus, which again is a powerful immune suppressant drug. So it's supposed to help you, you know, go through this pregnancy, but we're not thinking about the powerful impacts of those drugs on on other aspects of our body. I think the whole process is incredibly stressful. So just anecdotally, I look at women who I see in my hormone clinic when they're approaching the perimenopause and menopause, and I find that actually their menopause experience seems to be harder. And when I actually look at the different factors, and very often some of them are in very stressful jobs or they've got a lot of life stresses, and I do adrenal stress profiling, I very often find that their adrenal hormone pattern is flattened. And I think that the drugs that you're given during the course of IVF treatment and the whole stress of the process, I think can cause adrenal burnout. And this is something that remains, and people don't realize that they have it. And then this makes the menopausal experience much worse. So I think there are big impacts. And I think also, although, we love our children when we have them in our mid-30s, but I think the actual, being a mother, and raising children takes a lot of energy. And I think, as women get into their late 30s, early 40s, we have other facilities, like, in general, people are more financially stable and they might be able to buy help in, etc., etc. But I think our bodies definitely, we know, that actually your 20s is the optimum age for biologically for you to have children. Now, that's not in our today's world, that probably isn't possible, but that's the true biology of the situation.
I definitely need more sleep. In the thought of a newborn, you have to really reflect and think about that in terms of the lifestyle impact.
Yeah.
And I'm glad you said this, because honestly, there were so many impacts from taking the IVF drugs. I had to have 2 cycles before my son, with God's grace, arrived. But actually, I couldn't find much research, and I'm just wondering, is there been more research being done about the longer term impacts of?
Well, I mean, I'm always fascinated by this, because I sort of think, well, what are the endpoints? So I actually did some research before, we prepared for this talk, and actually it's quite patchy. Number one, I want to look at what is the impact on women post IVF treatment. Now, you've got to remember, IVF is still relatively in its infancy when you think about the history of medicine. So, measuring the outcomes is going to take time. Most women who had it, are still maybe in their 50s or 60s. They're not, older than that. So, do we have increased rates of breast cancer and ovarian cancer from all of those powerful medications? That I think there isn't enough consistent research. The other area I've looked at is, what's the impact on children born through IVF? Now, there was an article in the BMJ, quite a few years ago, saying that there was an increased risk of chromosomal abnormalities and developmental abnormalities. But again, there's not any definitive body of research, and again, people need to be followed up. And, we have such, the IVF process can be very disjointed. There'll be NHS clinics who are doing it, there are private clinics who are doing it. People can self-refer themselves to a private clinic. So your GP may not even have an idea that you're going to a private fertility clinic. And at least in the UK, we have, relatively nationalized records, but in the States, people don't have a defined primary healthcare system. So it's actually very difficult to look at the data objectively. But I think, more research needs to be done. And certainly, I think, I think there probably is an increased risk. And certainly from my own general practice, I have seen some cases where people have had a lot of IVF treatment, and I have seen some particularly surprising things happening in their children. I've seen someone whose child of age 10 has developed a demyelinating disorder, which I'd never seen, in all my years of practice in any child, really. So, whether that was, after the result of 8 or 9 cycles of IVF that poor lady had, I don't know.
And of course, there's the stress. I mean, once, you get pregnant through IVF, there's the whole anxiety of the baby arriving, which in itself, does that impact the baby? Who knows?
Yeah, I mean, we know that, that's why I really like integrative fertility, because integrative fertility looks at your whole health, and we know that stress has a massive impact on fertility. So unless we address people's general health, how they're managing stress, how they're living, what their lifestyles are, these are the fundamental things. And, if people can look at all of those things before they enter, even a natural fertility journey or an IVF fertility journey, I think we provide a better environment for, the growing fetus. And we know that, the fetus is impacted by the maternal health, right from, minute there is conception.
Yeah. And now, some of the clients that I work with, it's all about working on their mindset and the emotional journey, and having that support, because it's that fine line between sort of, you know, it's such a difficult thing, fertility, because it goes right into this like primordial level of what it means to be a woman or a human being, and part of the creative and reproductive process.
Absolutely. I mean, it's a massive drive, and it sometimes I have to laugh. I think it was not always rational. It was really biological, because having children is, it's a demanding job. But there is a real biological drive for people to want to have children. They feel that this is something that's going to make them feel complete. And I think there's a real sense of, failure when and there's a lot of stigma, there's cultural stigmas. I mean, what I was really fascinated about is that it's of the IVF people who have IVF in the UK, 40% of them are BAME. And, certainly we're not 40% of the population. So, I was quite surprised by that statistic. I mean, I don't know whether there's been any more research done into that.
It's massive, this, because, previously, in previous generations, a woman, I mean, just look at Abraham. He wasn't conceiving with Sarah, and so took a handmaiden just to have a child. And through history, we see kings displacing their wives if they're not giving them an heir, a male heir, right? And so this pressure to conceive on a woman is massive. And because I was obsessed. I mean, that sort of like pee on the ovulation stick, yeah. And then you go through that emotional cycle of, oh my God, is this the month? And it was like I was a demon obsessed with what was happening with my body and if it was going to happen.
Well, it is a massive, it's a massive financial, emotional, psychological journey, really. And there's a lot of relationship stress, because, people can blame each other. People can say, oh, you're not looking after your health. You're not looking after your health. It's your fault. It's my fault. It's so traumatic. And I think, when people then, go through all of that and then it's not successful and then they've got to have another cycle, I think that, the rate of relationship breakdown is quite high.
I'm not surprised. They say
so that's the thing, is I think it does create a lot of stress.
They say, like, because we lost a child prematurely at 24 weeks and 2 days, she sort of passed after 10 hours, and they say the statistics on it is 1 in 2 couples divorce because they can't deal with that sort of grief. No. IVF is like a grieving process as a couple of dreams maybe not being met, and no one chooses. I wouldn't wish it on an enemy, because I wouldn't want to choose it. It's a different way. So let's talk about the different way. So let's say a woman watching this interview in her 30s is wondering, well, how do I deal with my potential infertility? I don't want to do IVF. So where does she go, and what would you advise her?
Well, I think people need to also understand that, when we define someone as being infertile, we say that 90% of couples will conceive within a year. And of that remaining 10%, another 90% of those will conceive within another year. So the thing is, it's hard to make that definition until you've actually been trying for a year properly. To say, oh, I've got some fertility issues. So the key is to, maybe we need to start thinking about it when we're a lot younger. What are my hormonal patterns? What is my body doing? Do I ovulate regularly? Am I generally healthy? Do I have any other health conditions? So we know that women who've got polycystic ovarian syndrome or endometriosis, they can potentially have fertility issues. So women with polycystic ovary syndrome, because they don't ovulate regularly, they're not infertile, they tend to be subfertile because they're not ovulating as regularly. Now, you've got to remember that we ovulate in general 12 times a year, so you've only got 12 hits in a year. It's not that high. You know, and the window of opportunity when, you know, the egg only lives for about 24 hours. So literally the sperm have got to be waiting in the wings to, you know, to fertilize the egg. So, you know, when people have got busy lifestyles and they're traveling for work, you know, very often they don't actually meet that window of opportunity. So it's looking at, have I got other health conditions? Diet and lifestyle is massive. So we know that diabetic women definitely have increased rates of infertility, but even being overweight means that you become insulin resistant, and insulin resistance also affects fertility. So that's another thing. Exercise, increasing blood flow to all your organs, it definitely improves your fertility. And then there are certain, you know, supplements that you can take that can really improve your fertility, looking at your mitochondrial health. Your mitochondria are the little powerhouses in your cells, and the environment of folliculogenesis. So when you're developing an egg, you know, you need really good mitochondria. And so there are lots of supplements that can support the mitochondria, things like even things like intermittent fasting or taking a cold shower can stimulate your mitochondria to be stronger. So it's looking at all these sort of general health things to make sure that, you know, your chances of being fertile are higher. So deal with all your health issues, find out what your health issues are, go and talk to an integrative fertility doctor. You don't have to wait till you've been diagnosed with having a fertility problem. You know, I think there's real mileage in anticipation. So, you know, even when we're talking about perimenopause and menopause, you know, we're trying to educate women now that menopause is not, you know, falling off the cliff when your periods finally stop for 12 months. There's a huge process. You know, for a number of years beforehand, when we're in the perimenopausal period, when we're having hormonal changes. So to start becoming much more aware of your hormones. So, you know, we both talk about the book Wild Power. So it's actually, you know, teaching women to become much more tuned with their bodies, teaching women to become much more tuned with their menstrual cycle. So, you know, we know as well that, you know, the human body, the female body, it's totally geared up all the time to reproduce. So, you know, when you're young, when you're ovulating, that's what your body wants to do all the time. And even if you think it doesn't, your body is geared up for that. And so any kind of threats, you know, the body will perceive it as a threat to your fertility. So this is where stress is such a major factor. You know, we know that when your stress hormones go up, so the cortisol and prolactin, they actually inhibit ovulation. So they actually inhibit the hormones that stimulate your ovaries to release an egg. So there's a complete physiological connection. So we really do need to be in, you know, a calm space where our bodies are saying, yes, you're ready to get pregnant. You know, I don't think that that's sort of, you know, our fertility responds to being scheduled like we do in the modern world.
I'm so glad you've raised all of this, because as part of my fertility journey, so for me, after having had one, I didn't think I had a fertility issue. Then I found out about secondary infertility, right? We'll talk about that more in a minute. But the natural rhythms was the big game changer for me. Well, two things: changing my diet, because I had a history of endometriosis. So ladies, anyone with endometriosis thinking about conceiving, please start to explore your diet. It is the biggest shift, or the thing that can make the biggest difference to your entire journey with this. And then the natural rhythms, that was a game changer. And it was really exciting to start to understand my body better. So to look at the changes in the secretion and to kind of understand what the egg yolk was telling me about the, you know, point of where I am in my cycle. So I love how you bring this, you know, awareness and knowledge actually to people. What else can you tell us in terms of, you know, people who want to go down more of a natural pathway with this? You know, when you've mentioned it's like you have to try for a year before you then go to seek help.
Yeah. So I'd say in that year, perhaps focus on your general health. Now, there are now a lot of people who are fertility coaches. So you don't have to say, well, I'm infertile before I go and see a fertility coach. You could start going to see a fertility coach before you're thinking of embarking on becoming pregnant, because very often you may not have insight into the things that may impact your fertility, but someone who works with you and your partner in optimizing your health, reducing your stress levels, improving your relationship in a way as well, that's going to lead to, you know, much more increased chances of you having a natural pregnancy. I mean, of course, look, people get pregnant all the time, and you know, sometimes you don't need all of this input, and you know, people start trying and immediately they have a child. But we know that, you know, people are having kids later. Biologically, there is a problem, so inevitably there is going to be a delay in fertility. And the thing is, once people get to the 1 year of not having conceived, now when we look at those statistics and we say 90% of couples conceive within a year, we're talking about people from the age of 20. So on average, that's what the statistics are. But probably when you're in your mid-30s, it could take naturally a little bit longer. But once people have got to even the 6-month stage, if you're 37 or 38, you've been trying for 6 months or a year, panic sets in. And when the panic sets in, and also people, you know, we're used to scheduling our lives and we're thinking, well, I wanted to have a child by the time I was X, Y, and Z, and I'm not having it, and I want to have 2 or 3, and how am I going to fit them in? So panic sets in. And I think this is where, you know, people panic. And then, you know, after you haven't been conceiving for a year, you know, you can potentially be referred to the fertility clinic, start having investigations. But sometimes we find people don't have an underlying cause for their infertility. It's just age. But the thing is, people then panic and they think that they just want to do the IVF because at least that, you know, they think they're doing something concrete to help them with their fertility. I think it's very hard, isn't it? It's very hard to think, you know what, I'm just going to give it a little bit more time when people have started the panic. And then when the panic starts, the stress levels rise, and then you're in a bit of a vicious circle.
Well, stress is massive. And I remember I was blessed to have an amazing GP, Dr. Provost, if you're thank you so much, because she just sat me down, and I was working at Bloomberg at the time, and I had 4 a.m. starts, and my whole cycle was wacko. It was almost like I could have been a flight attendant traveling because of the unnatural hours that wasn't supportive. And so she sat me down and she's like, look, you may need to make a lifestyle choice and reconsider. And it was so frightening at the time because, you know, I didn't really want to leave my job, but I just sort of thought, well, what is my priority? So choosing to leave a very, like, an amazing career at the time to focus on having a child. But obviously you can't really talk about that with employers, can you? Like, oh, I had a career gap, so I could focus on becoming a mum. It's not really what professional people want to hear. So if I
mean, I'm glad you're saying about the fact that you had 4 a.m. starts, because, you know, when we're talking about natural fertility cycles, and we're saying that, you know, your body's all geared up to want to get pregnant, but, you know, it senses any kind of shift in stress levels, you know, it senses it, but it does start with your brain. So circadian rhythms are actually incredibly important for your fertility cycles. So if you're getting up at 4 in the morning on a regular basis and, you know, you're trying to get pregnant, your body's saying, this is dangerous, so we're not going to get you pregnant because somehow, you know, you're not going to be able to sustain a pregnancy. So the circadian rhythms are really, really important. You know, the sleep cycle, you know, before people want to try and get pregnant, they should be getting good 7 to 8 hours of good sleep, because sleep is so important in detoxifying our bodies.
Yeah, and I guess it's all coming back to the self-care and self-love, and it's almost like starting to mother yourself as you enter the process of mothering others.
I think there's a lot to be said for that. You know, is that we do need to be in good physical and psychological health before we embark on motherhood. And then the whole motherhood journey is also unpredictable. You know, I mean, I've had patients who've conceived a third child, and it turns out to be the third child turns out to be twins. So they've gone from 2 children to 4 children overnight. You know, also we don't know, are our children going to be born healthy? You know, children can have issues in, neonatal issues in childhood. There's so many things that can happen. So it is unpredictable, but I guess we need to be in the best position possible. And I think our health needs to be optimized, not just for fertility, for everything.
Yes, and actually you triggered my memory of what I wanted to share, which was after sort of a 7-year infertility journey, having 2 IVFs, I then conceived unexpectedly, and 17 months later, through a natural pregnancy, my daughter arrived. So there was something about sort of the IVF, and I wonder at times if some of the drugs were still floating around the system to help. But it's not uncommon. I've heard of quite a lot of
No, it's incredibly common. So after people have had, IVF pregnancies, they very often will go on and have a natural pregnancy. I've had patients who've gone through the whole adoption process, adopted a child because they were infertile, and then had a natural pregnancy. So this is what I'm saying, is that, our bodies don't always go, they're not going to respond exactly when we want them to respond. And, very often your body falls pregnant when it's ready to get pregnant. Now, we may not know what those mechanisms are, but stress is a major factor in it for sure.
Ghazala, let's talk about the pill, and where does that leave your infertility if you have been on the pill for a long time?
I mean, I think one of the things that we've talked about is being aware of your natural cycle. So very often people go on the pill when they are, in their teens as a student, and then they remain on the pill for, decades sometimes. So again, there is not much awareness of what their natural bodily patterns are. There is evidence to say that repeated use of the pill actually thins the endometrial lining, and you don't have the receptors for progesterone and estrogen in the same way that you would normally. I think the other thing about the pill is that, it changes your brain. So, well, I mean, I've got this fantastic book. It's called How the Pill Changes Your Brain. And it's an amazing book. And actually, it's written by a social psychologist. And she's looking at how actually the pill has changed the nature of female relationships over the last few decades. So we know that actually natural ovulation has a lot of benefits. So we've already touched on the subject that actually your body wants to get pregnant. So actually going through ovulation is really important. Now, from a sociologist perspective, she notes that at ovulation, women are much more interested in their appearance. They put their makeup on, put their red lipstick on, because, their bodies are saying, you need to get pregnant, you're ovulating. And men find women much more attractive when they're ovulating. So when we block ovulation out, you've got to remember that we are giving our body synthetic estrogen and synthetic progesterone. When we block that process out, then inevitably we're losing a lot of these natural biological drives. And another thing that I found really fascinating was if you're on the pill when you meet your partner, you may be attracted to men with more feminine characteristics. At the time of ovulation, biologically, women are attracted to socially dominant men. So when women come off the pill, very often, they can feel quite differently. I mean, even Sarah Hill, she talks about when she came off the pill after a decade, she went from a 2-dimensional black and white movie to a 3D meaningful reality, as she puts it. So I think, if we think that, gene transmission is like the evolutionary role of our body, natural estrogen actually heightens a lot of a lot of things that we do. So it's the feel-good factor. It makes, the movie more exciting. It makes a chocolate taste better. So natural estrogens are actually really, really important. The other thing is that we know that we've talked about the HPA axis. So this is where, our stress hormones and our reproductive hormones are all controlled by this axis that comes from the brain, with hormones that's secreted from the brain. And when we look at the cortisol patterns of women who are on the pill, we find that their patterns do not follow a kind of diurnal rhythm. Cortisol levels are generally higher, and some people have cortisol patterns similar to someone who had PTSD. So we know that, you know, and this is why I do think, you know, this is my anecdotal experience of working in a hormone clinic, that actually women who have had IVF, when I'm looking at their adrenal function, very often their adrenal function is suppressed because of that. So I think, you know, now we've got the research on the pill, I'm pretty sure that my anecdotal observations are probably quite true. We know that natural progesterone is our natural antidepressant, and estrogen is it interlinks with our neurotransmitters. The neurotransmitters are the chemicals in your brain that, you know, that regulate a lot of our moods and our emotions. So estrogen feeds into the dopamine signaling system and the serotonin signaling system. So we know that, you know, there's been studies done in Denmark, and we know that if you are on the pill, within 6 months, you're 50% more likely to become clinically depressed, and 40% of women are offered antidepressants. The frightening thing is it's much more common in teenagers from the age of 15 to 19, and there is a 3-fold increase in the suicide risk. So the pill can impact on people's moods, for sure. Now, you know, the converse of that is actually there are a group of women who are ultra sensitive to the natural hormonal cycles of the menstrual cycle, and they get very severe PMS or very severe PMS that's called PMDD. Now, the pill can actually really stabilize them. So the pill can have a role, and the pill has got many roles, but I think we need to really be aware of, you know, the other issues with it.
I think it's, once again, I mean, this reminds me of what we shared somewhat when we explored menopause. It's like having to re-educate ourselves as women about our bodies. I remember when I learned about the natural rhythm cycle, I was blown away about how much, as a control freak, I could control my time of conception just by understanding the bodily changes in my secretions. So it can be used as a natural contraceptive. We've talked about modern mothering and careers, but I'd love to revisit it. I mean, oh, it's just this forever. You know, I don't know that many working mums who aren't stressed out.
I think they really are. I mean, I really think, you know, I see that all the time. You know, I mean, I think the optimum number of days, you know, that you can work when you're a working mother is probably about 3 out of 5. You know, I think it's very difficult. And I think, you know, we now live in nuclear families. And I think, you know, that concept of it takes a whole village to raise a child is probably very true. And I think that the nuclear family puts a lot of stress on the couple. Women are still taking the burden of domestic responsibility. So, you know, you end up trying to do all of that. And, you know, this concept of women are really good at multitasking. I mean, that's true, but I think multitasking probably comes at a cost to us. So we can do it, but I think there's a cost to that.
I think we can do it till we hit the menopause. I mean, there is no multitasking because of the foggy brain syndrome. But I think the other thing that you've just touched on is, you know, because I was reading about the impacts of COVID on women.
Yeah, no, I read some really good articles about that.
And you know, it just makes me really sad to think that more antidepressants are going to be handed out to women.
I think it was Melinda Gates who said that, you know, we've set back the you know, the progress of women by a decade. I mean, whether that's true, I don't know, but certainly proportionately more women have lost their jobs. I mean, certainly in, you know, in general practice, you know, I've had a lot of women present with palpitations, you know, and then when I'm asking them, you know, what's going on in their lives, you know, they're homeschooling, they're trying to hold down their jobs. I mean, I'm so grateful that my daughters are teenagers, because I don't know how I would have managed to homework, where, you know, or, I mean, I don't always work from home, but I sometimes work from home if I had children that I had to monitor. So I think it's been
I can tell you about that.
I think, you know, I think there's a lot more women, you know, drinking a lot more, you know, trying to find ways to cope with the stress. So yeah, I mean, I'm hoping that that's not true, that we haven't set back our progress, but I think, you know, there's going to be a lot of fallout.
No, I mean, I've had to meditate every single day, like, you know, like a military commander in that, just to be able to deal with the day. So, you know, if it's meant getting up earlier to just fit that in, to stay regulated, because it's been, but, you know, and all of this then, of course, is I'm mindful of these sorts of impacts. I mean, not those, you know, maybe those going through secondary infertility, maybe those who, yeah, are just caught in this space. But can you just share with me, I know you've got an amazing example, because, you know, this is such an amazing chat with you to kind of explore these generational shifts that we're seeing as women. And as, you know, women are stepping up across the world into a new phase of empowerment, or certainly that's how it feels on some levels. I love the story of the unnamed woman, the not known woman, who actually I owe my son Rayan to, because unbeknown to me, she actually helped bring IVF into the world.
Yeah.
And yet she's not mentioned at all.
Yeah.
Please tell us.
So I'll tell you about the story of Miriam Menken. So I think she's a Miss Genius, really. So she was the first woman who fertilized a human egg in vitro, and this actually happened in 1944, and it took her 6 years. So she was working for a very well-known fertility specialist called John Rock, who was at Harvard, and she basically was born in 1901. In Riga in Latvia. She emigrated as a toddler to the States. Her father was a doctor. She managed to get 2 degrees at Cornell and Columbia, and she was rejected from medical school in 1945 because the board of medical schools said that the primary role of a woman was to reproduce. And she therefore didn't go to medical school, and she ended up marrying someone who was a medical student at Harvard, and she worked as a secretary to support him. And this is when she met John Rock, and she started working in his lab. So every day for 6 years, she used to go on, every week for 6 years, she used to go on an egg hunt. So she used to wait outside his operating theatres on a Tuesday. And if she was lucky, he would give her a piece of ovarian tissue that he'd got from somebody. And the piece of ovarian tissue would be about the size of a hazelnut. She had a very, very keen eye, and she could see within that tissue the egg, which is the size of a full stop. And she would then extract the egg, put it on a Petri dish, and she would wash it with sperm. And she used to watch it for 30 minutes to see if anything happened. Now, on this fateful day where it actually worked 6 years later, after 138 attempts, she'd actually been up all night with her 8-year-old daughter who had epilepsy, she'd had some nocturnal fits, trying to soothe her. And actually, when she was watching her Petri dish for the half an hour that she used to give herself to watch it, she fell asleep. So she ended up not doing anything with it for an hour. And it was after an hour that actually she suddenly saw that the egg and the sperm had fused, and that actually this was the first example of in vitro fertilization. So she basically carried on doing her research with John Rock, but then her husband lost his job and they had to move to North Carolina. And in North Carolina, there was a lot of antagonism for IVF, and they called it rape in a dish. And so she wasn't really able to continue with her IVF research, though she did collaborate with John Rock remotely, which you think of, you know, in the 1940s and 1950s can't have been easy. And in
hold on. They called it rape in a dish.
Rape in a dish, yeah. They thought it was really immoral for people to, you know, a lot of, pro-life people might be thinking, oh, that's interfering with nature. So in 1948, she published a full report on her research with John Rock. At the same time, her personal life was in turmoil, and her husband was actually quite abusive, very controlling. And she writes in her diaries that, she would like to leave him, but she worries about the stigma on her 2 children she has with him. But then in the end, she said that, this was going to be a slow death if she didn't get out. So basically, she got custody of her daughter. She had to leave her son with her husband. She got custody of her daughter, who was epileptic, moved back to Boston, got her daughter into a special school, and then started collaborating with John Rock again in the 1950s. And then their research was not on IVF, but it was actually developing the combined oral contraceptive pill. So then she was stopping people getting pregnant. So, you know, this is a real example of, you know, what happens in so many women's lives. You know, what might her life have been had she been in the modern day, where, you know, she would have been able to do medicine, she would have been able to be a name in her own right, rather than sort of being under the umbrella of, you know, some top fertility specialist. And actually, you know, it was her perseverance and her accuracy, you know, that got the results. You know, she actually had to really work hard, and she was very meticulous in the way she did her research. So yes, I think it's really important for us to recognise Miriam Menken.
Miriam Menken, I mean, I cannot thank her enough, and I almost felt tears as you were sharing her story.
Yeah.
And as you mentioned, rape in a dish, what also came up for me is what I alluded to earlier, the feeling of shame as a woman needing IVF. And it just also begs the question of male infertility.
Yeah.
How the responsibility, when it's not working, seems to be blamed onto the woman automatically. Tell me more about that.
So yeah, interestingly, male infertility factors are identified in 40% of couples. So that's quite high. And with male infertility, we know it's linked with other health conditions. So, you know, again, when I talk about, the functional medicine approach to fertility, we know that semen quality is a biomarker of overall male health. So we know that, you know, if people have low sperm counts, it's often linked with other health conditions like cardiovascular disease, diabetes. There's a higher prevalence of reproductive cancers like testicular cancer, prostate cancer, 3 times higher in men with infertility issues. And, you know, we think it's a lack of physical activity. People are drinking more, they're fatter, cigarette smoke, increased cholesterol rates, insulin resistance. The other major thing at the moment, you know, there's a fantastic article published in The Guardian today, was about, actually there's a reproductive epidemiologist called Swan, who's done loads and loads of research, and it was actually looking at the endocrine disruptors in our environment today. So it's looking at the plastics and the chemicals in our environment that we're totally unaware of, that are having massive impacts on our endocrine systems. So phthalates are the substances in plastic that make plastics soft and pliable. So, you know, that's how we get our cling film. That has an impact on testosterone production. We know that bisphenols, which are what make plastics hard, they're very good at disrupting the estrogen balance. So we know that we are seeing more precocious puberty, we're seeing more premature menopause through these endocrine disruptors that are so prevalent in our environments. We've got them in flame resistant materials, you know, so nowadays all sofas have to be flame resistant, but those chemicals are endocrine disruptors. Even non-stick pans, you know, the Teflon, that's got quite a profound impact on the thyroid system and the immune system. So this is a massive problem. I mean, Swan, in her studies, she postulates that by the year 2050, most people are going to need ART techniques to get pregnant. And if we look at sperm counts, she studied
9 by 2050.
This is what she's postulating, because we are seeing so she studied sperm counts over the last 40 years, and men of today have 50% the sperm counts of their grandfathers, and that is a trend that's continuing, you know.
So hold on, we're kind of like, as a species, it's from both sides.
Yeah, absolutely.
Dropping, the female infertility dropping. You've talked about some of the things in the environment, in our plastics, you know. We haven't talked about 5G, we haven't talked about technology, we haven't talked about, you know, what is being emitted energetically out of mobile phones and all the technology devices. I'm pretty sure that's making an impact.
No, I'm sure it is.
About food,
together,
because food, you know, and the whole food
pesticides in the food,
pesticides, sugar, so it's almost like we got to get back to being cavemen and cavewomen if we want to.
Well, I think I think this is also, COVID's brought this out, is that, we're always pushing the boundaries in scientific research. We always think we can beat nature, and COVID's taught us that actually we can't beat nature. I mean, we're doing a good job with the vaccines, but still, when we look at what is the root cause of what caused COVID in the first place, what caused coronaviruses, there's lots of research that says that the ecological environments in the rainforest has made, bats, produce those bats which have produced these zoonoviruses. So those are the root causes. So it's what man is doing to the environment that is shifting things to create these new diseases. So again, the more and more progress we think we make, and the more and more, we have these, chemicals in our environment. We're trying to, mass produce food. No one's thinking about the soil quality. We expect to have a huge variety of food, a huge range of food from all over the world. Green vegetables that are shipped in from Kenya. All of these things. It's like mad.
I was reflecting on that the other day down in the supermarket. I was like, oh my God, like everything just coming in.
Asparagus has come from Peru, and the sugar snaps have come from India. And it's like, well,
and how can they look so perfect in the wrapper from the point that they got picked to landing in my kitchen? Because I'm going to have to wrap it up, I'm afraid. I could chat to you for another hour easily, but just key takeaways. So for anyone out there going through fertility struggles, drop us a line, get in touch. If you need help with your mindset and coaching, press on the link below. And if you want to reach out to Ghazala and get more information and expertise for your specific journey, all the details will be available. But any last key takeaways, Ghazala?
I also want to mention, when we're talking about male fertility, we know that the female sort of sell by date is 35 plus. Well, we also know that there's a male sell by date. It's a little bit older, but it's basically between the ages of 40 and 45. We know that men also have decreased sperm motility, increased DNA mutations in the sperm. So it affects men as well. And men over the age of 50, there's an increased risk of miscarriage in those pregnancies, decreased live birth rate, increased premature birth rate, and an increase with autism and ADHD risk, with both male and females being older when they have children. So I think it's a real public health issue, in terms of the health, healthy men and women before they have children, healthy fertility, producing the healthiest offspring that we can, without all of these other risks.
Yeah, that's fascinating, because actually it kind of comes back to one of the points you raised before, which is how we do it together, how we bring the masculine and feminine together, and how you grow through that relationship and supporting of each other to be, the best in health, the best in mind, the best emotionally, to bring in this life, God willing. Thank you so much, Dr. Ghazala Aziz-Scott. You've given me so much to again reflect on, and I'm taking away that I'm going to keep growing my vegetable and herb patches.
and you have to grow broccoli sprouts. They are the new superfood.
Broccoli sprouts. There you go. Fun news. Thank you again.
You're most welcome. You're most welcome.
Hi everyone, thank you so much for joining me on Tazeen TV. Now, as a transformational life coach, I help and support those who might be feeling stuck, or who just want to connect deeper to their sense of self and purpose. So maybe have a look at some of our offerings, and why not join me on one of our free workshops to begin that journey of aligning and optimizing your life. Now, for those wishing to better their telepresence, you can find out more about our media training offerings. Again, have a look at the website, and I look forward to continuing journeying with you soon.